Hi, my name is Stephen. I'm a nurse here at Mayo Clinic, and I'm going to teach you how to do the dressing change on your central line. Before we start, we want to make sure that the surface that we're working on is nice and clean and that we've washed our hands with either soap or water or just a sanitizer is fine. Once we're clean, we want to make sure that we have all the supplies we'll need to do the dressing change. To do the dressing change, we'll need 2 pairs of clean gloves, and then you'll also have a dressing site care kit that you can get at the Mayo Clinic store or other medical supply store. In the kit, they usually come with 2 masks, one for yourself and one for the person actually getting the site care done. You'll need a ChloraPrep swab stick to do the cleansing of the skin around the insertion site. You'll need a BioPatch that will go, it's an antimicrobial disc that will go around the insertion site where it goes into the skin on the chest. And then a Sorbaview shield contour dressing to put on once you've cleaned the skin in the area. Also, when you do the site care, you want to make sure to change the caps on your line. So you want to make sure you have some new caps that you can put on the line when you're ready to do that. Once we know that we have all the supplies we'll need, we can go ahead and do the site care. So before we begin, we want to make sure that you put a mask on. Whoever is in the room puts a mask on. Now for demonstration purposes, I'm just going to have you pretend that I have a mask on. We want to take our first pair of clean gloves and put those on to take the old dressing off. Go ahead and put some gloves on. To remove the dressing, we want to start at the bottom of the dressing and peel upward towards the window portion of the dressing. So you want to kind of grab the bottom edge. Once you've gotten the bottom up, you want to tear along this perforated edge underneath the catheter like so. And you'll just keep peeling around the edges, working your way from the outside in towards the window dressing. Once you've gotten the edges peeled back, you can go ahead and peel the rest of the dressing off, like so. Once the dressing's off, you can go ahead and take this BioPatch off. Go ahead and, there's a little slot in the BioPatch that you'll want to line up with the catheter and carefully take it back, being careful not to touch the insertion site. Once the old dressing's off, we'll go ahead and take our gloves off and throw those ones away and wash our hands again. Once our hands are clean, we can go ahead and put our second pair of clean gloves on. Then we want to open up our dressing. Remember that you keep your mask on for the whole time. Open our BioPatch so we have that ready to go as well. And then we'll take our ChloraPrep cleanser. You'll squeeze the arms of the ChloraPrep together till you hear a crack, and then you'll see the fluid that'll flow down into the sponge of the cleanser. And then using back and forth motions, you'll scrub around the insertion site and all around where the new dressing will be for at least 30 seconds. Just want to make sure you clean the skin really well so there's no germs hanging out underneath the dressing. Once you've cleaned the area, you want to make sure you let it air dry for at least 2 minutes to make sure that the new dressing will stick really good to it. While it's drying, you want to make sure that you don't fan or blow on the insertion site. Just let it air dry until it's completely dry. Once it's dry, then you can go ahead and take your BioPatch, your new BioPatch, and go ahead and place it around the central line. You want to open up that slot and place it around the insertion site, making sure that it goes underneath the catheter so that the entire patch is in contact with the skin. With that in place, we can go ahead and put our new dressing on. So we want to take the largest portion of that Sorbaview shield dressing, what we sometimes refer to as the shirt, And on the back there's 2 tabs that you can peel back, and we want to peel back the largest one to expose that window area of the dressing. We'll go ahead and put that on upright with the top of the shirt towards the head. We want to make sure that the insertion site with the BioPatch is in the middle of that window so it's clearly visible. We'll go ahead and press down on that window area first, and then go ahead and smooth it out to the outside. Once that top portion is in place, we can go ahead and peel back our bottom portion. As we lift the catheter, we can go ahead and press down around it and have these 2 bottom tabs overlap underneath the dressing to hold the bottom in place there. Once the main part of the dressing is in place, we can take the second piece, that's a little bit smaller, what we refer to as the pants, and with the slot facing upward, we're going to slide it underneath the catheter, right around both sides of it. And then it has 2 tabs that we peel on either side. We start on one side, peel back the backing, and then we secure that side in place. And then we do the same thing on the other side, peel back the backing, fit that in place. Once the dressing is in place, we can go ahead and change the cap on the end of the line. So you want to take your clean cap and hold it with one hand carefully. With the other hand, you'll pick up the end of the catheter, go ahead and screw the old cap off, being careful not to touch the end of the line, and throw that cap away. And then you carefully take that plastic piece off the end of the new cap, and then carefully screw it on to the end of the line like so. Once the dressing and cap are changed, we want to make sure that we put today's date on the catheter, and on the back of the dressing usually there's a strip of tape for that purpose. You can write today's date on there, peel it off, and stick it somewhere on the dressing so that the next person will know when it was changed last. Now that you know how to change the dressing on your central line, if you have any questions or concerns about infection or any concern about the line, be sure to contact your healthcare provider.